The first thing is a feeling of not being right. If you get a feeling within yourself, trust your feeling and trust your intuition and go and get yourself checked out by a specialist. The other one is pain. Pain is a marker. Pain is a huge marker. Any sort of bleeding at all.
Right.
Pre-pregnant, during your pregnancy, afterwards you have lochia going on and other stuff going on. But just the biggest thing is during pregnancy as well. Make sure if any bleeding gets checked out. And needing to go to the toilet all the time will tell you, as we go through pregnancy, there's much more weight on your bladder.
Yes, you do tend to go more even.
You tend to go more. But if you find that you are going, if you talk to your friends who've been pregnant and, if you're going on a lot, then go and speak to a specialist, because it could be that you're just not managing your intra-abdominal pressure as well as you could be. So during pregnancy, we can still manage our intra-abdominal pressure.
Today, we're diving into a topic that affects millions of women, yet is still not talked about nearly enough: pelvic floor dysfunction. Whether you're experiencing bladder leaks, pelvic pain, prolapse symptoms, painful intercourse, preparing for pregnancy, or navigating postpartum recovery, your pelvic floor plays a vital role in your overall health and well-being. In this episode, we're exploring what pelvic floor dysfunction really is, why it happens, and most importantly, what you can do about it. So let's dive in. Hello and welcome to the Holistic Health and Hormones podcast. Today, I'm excited to have Abby Lord, who is a pelvic floor and movement educator, prolapse warrior, and a TRE provider. She's also a mum to 2 teenagers and a partner to an ace husband. She has been working with pelvic floor for over 12 years, and she's a master trainer in hypopressure. How are you, Abby?
I'm good, thanks, Ellie. How are you doing?
Good. Welcome to the podcast. Look, I think this is a big topic because I see a lot of women postpartum, and there has been a lot going on with so many things after postpartum. So it's such an exciting topic. I'd love to dive deep with you today. Let's explain exactly to the people what is the pelvic floor and why is it so important?
So the pelvic floor is not actually a floor. The pelvic floor is actually a hammock of muscles, and there's more than one of them. And we have muscles that help to support or create continence. So we've got muscles that kind of come around your urethra, your vagina, and your anus that help with force closure so that you don't leak from any of your orifices. And they also help to create pelvic tone and also help to support your pelvic organs. The pelvic floor is shaped like a hammock. So it's more like a funnel kind of rather than just a normal hammock. And it's made up of lots of different muscles. So the group of muscles we often see as our pelvic floor is called the levita ani. But we also have the support of the piriformis that a lot of people have heard of, and also the obturator internus there too. And there's also loads of fascia too. So there's quite a lot going on in the pelvic floor that's nothing to do with being a floor.
Why do they call it the floor? Is it because it's at the base? Like, why have they given that common
I think it's
name?
the base. It's seen as being the base of your pelvis. So I think that's why it's called the floor. Yeah.
So why is there so much floor dysfunction? Like, how common is it? Is it mainly in women postpartum? Like, where is the commonality with people who are getting dysfunction around those muscle groups?
So it's to do with postpartum. It can be to do with birth injury.
Yes.
So things like forceps delivery, ventouse, episiotomies, long pushing periods. It can be to do with the weight of the baby during the pregnancy. So you can have pelvic floor dysfunction even if you've had a C-section. So there's with postpartum period, it tends to be because of the weight of the baby or any sort of trauma that you might have had. But it's not just postpartum women that have pelvic floor issues. Women who've had no babies at all also have pelvic floor issues. So people who do, tends to be more prevalent among people who do high impact sports, hugely prevalent amongst trampolinists, gymnasts. Yeah. And so the prevalence tends to be, it's about 1 in 3 women by the age of 40. and 1 in 4 by the age of 50, and no, 1 in 3 by the age of 40, and then it's 2 in 4 by the age of
Wow.
so it goes up, and it goes up as we age and our tissue types our tissue changes.
And what are some of the most common symptoms? So how do we know we're starting to get a dysfunction in the muscle? So obviously, there's a urine, you're having issues with going to the toilet. What else? What other sort of major common symptoms will they experience before looking to seek help?
So there tends to be a feeling of your pelvic, the lower part of your pelvis feeling heavy, there being a dragging sensation, pain quite often. Urinary incontinence can be perhaps when you sneeze or you cough, or when you run after your kid. Maybe they're on a bicycle and you're running after them, and you don't leak to start with, but towards the end you start to leak. Sometimes when you go for a run, just a regular run. But the pain and heaviness is a big one, and spasms quite often if there's stuff going on with your anus, and so if you've got stuff to do with the rectocele, quite often you can have anal spasms as well. That can show up as well,
Wow.
and
Okay.
needing to go to the toilet much more often as well, Ellie.
Yeah. Yeah. And why do so many women suffer in silence where they think, it's going to get better? And then does it get worse if it's been prolonged for so much longer?
So women tend not to talk about this because it's embarrassing. So especially they're worried that they might smell. They're worried that people might notice. They think they're the only one. They think they've done something wrong. There's so much advertising around just getting a pad and putting a pad in your pants. So a lot of women will default to that. Also, as women, we're so busy that we almost default looking after ourselves because we look after everybody else first. And will it get worse if you don't do anything about it? Yes, and it will get worse. It's not, unless you do something about what's going on with your body, your system, that's made your system out of balance, then your system will continue to be out of balance. And if it continues to be out of balance, then yes, there's in all likelihood symptoms will get worse.
Can it get better if they're sort of working on it and they know what to do and
Yes.
they catch it early enough?
Absolutely. It doesn't even matter if it's with my ladies that I see. Oftentimes I get women who come to me who are in their late 50s, early 60s, sometimes 80s. And their big question is, am I too late to do anything about this? And no, you're not too late. We can start rebalancing your system at any age. And when you start to become more aware of what your body's doing, then yes, symptoms definitely improve.
Is that also part of going to the toilet? I've got some clients in mind, but they're going to the toilet very, very frequent in the evening, right? They might be going like 5-6 times. I have a client who goes to the toilet 5 to 6 times. Not as frequent during the day, but at nighttime, like literally waking up every hour and a half to go to the toilet. Is that also part of a pelvic floor dysfunction, or is there a urinary incontinence? Are they all linked together with the bladder, obviously, and the pelvic floor?
They're all linked together. If you get up at night, it's nocturia. So nocturia tends to be, nocturia is like the nighttime version of incontinence during the day. And if you get up once a night to pee, then that's not considered nocturia. But if you get up more than once, it is considered nocturia. And most of my women, it's one of the first things that goes, the nighttime getting up to pee.
Right. And do men get affected by pelvic floor? Do they have any pelvic floor dysfunctions too?
Absolutely. So men get erectile dysfunction, urinary incontinence,
Yes.
anal prolapse, rectoceles. So the less rectocele because there's nothing to come out, but definitely rectal prolapses.
Right. And so what are the biggest contributing factors? Like we mentioned a couple to basically pelvic floor dysfunction in both. Let's start with women and then in men. What could be, so obviously sort of in the childbirth trauma, what other big contributors?
High impact exercise, prolonged coughing. So if you've got an illness where you have prolonged coughing, Ehlers-Danlos syndrome, where you've got really stretchy connective tissue, and age as well is another big contributing factor. And also, we can't ignore the fact that emotions play a massive role in this. So stress, anxiety, worry, grief as well has a massive component towards pelvic floor health. So it's quite a multifaceted kind of area.
Because you were just mentioning about stress, but also pregnancies. Obviously, if there's a bigger baby, there was trauma in childbirth. And if that wasn't addressed or looked after, or maybe getting some sort of help from different physios or, exercise physiologist or pelvic floor sort of experts, then if that's left for too long, then obviously, years later, if they're after a second baby, is that if they have more and more children after, say, the first one, they're
Not
feeling this.
necessarily.
Okay.
So quite often the damage is done with the first one. So quite often my ladies have gone, but quite often there's no actual research. There's so little research done on women's health. So there's very little research, but most of the women that I've seen, they've started seeing their issues after their first baby, and it's not really changed that much after subsequent babies.
Wow. Okay. So so it's not necessarily getting worse. It could possibly improve after a second or third if they've had a sort of severe pelvic floor dysfunction after the first child?
So improving, so it might not improve after the second, but it's not necessarily going to get any worse. But then, so a lot of my ladies who come to me and they've had one baby and then they come and they see me and we work with their posture, we work with their breath, we work with movement, we make sure that everything is working harmoniously together. Their second birth is much easier and they have fewer incidences of diastasis recti, and it's just a much, much better recovery period afterwards. So doing something after your first baby, if you notice you've got an issue, is really, really important. Don't put it off, because your recovery times will be better. You'll feel better about your pregnancy. The baby will sit better in your body. It'll all be just much better.
How soon after should they be working on that, even if they suspect there's no symptoms whatsoever?
So from when you have the baby, just really thinking about making sure that you rest properly after you have your baby. So my big thing I always say to my ladies is 1 week in your bed, 1 week on your bed, 1 week around your bed, 1 week in your house, then see guests, and then see people. Look after yourself first. But the other thing you can start working on immediately is your breathing, making sure you're really regulating your breathing, thinking about your posture, making sure if you're breastfeeding that you're also thinking about how you're going to stop yourself from your shoulders coming in the way, thinking about proper posture patterns straight away.
Because it's quite difficult also having a newborn baby. You're tired as well. Sometimes you're feeding in whatever position. Like I remember breastfeeding in the bed, on the couch, like just in any sort of whatever, because you're so tired. It's like, I'm just going to feed in whatever posture. And you just don't think about actually how posture is so important. So because all the muscles relax after childbirth, isn't it?
Yeah, the relaxing in your body has a huge impact. So even if you're too tired when you're breastfeeding to think about it, when you're baby wearing or when you're pushing the buggy or other times in the daytime, just having a little think about how you're holding your body is really super important.
Yeah. And are there any sort of hormonal changes that women need to be aware of during that perimenopause and menopause phase, whether they've had children or for those who possibly have never even had kids? Is it still affecting them if they've never had children?
Yeah, so each stage of our life that women go through, there's so many huge hormonal changes.
Yeah.
And at perimenopause and menopause, we have most of our pelvic floor is surrounded by fascia, connective tissue. So during perimenopause and menopause, we have a massive change in the way we create collagen and elastin, and we have a start of a breakdown of collagen and elastin. So the most important thing during perimenopause and menopause is to make sure that you keep moving. Fascia, connective tissue, needs movement to stay moist and juicy. So it's rather than slowing down, perhaps sometimes you need to think about changing the modality that you're using for exercise, but keep moving your body. But yes, definitely at menopause, a lot of my women who have had no issues before, suddenly at menopause, they're like, it was just like suddenly I felt something drop. And I'm like, well, it's less that you've maybe felt something drop, but that we've got less support through our ligaments and our fascia at perimenopause and menopause. And sometimes as well, Ellie, women can walk around for, they can have stage 2 prolapses and they can be walking around totally fine, not even notice, no symptoms. And then they just notice the symptoms at menopause because their fascia starts to lack that structure.
Or they think it's probably mild. Oh, it's probably not bothering them as enough to seek help. So, yeah. Is there any connection between pelvic floor dysfunction and fertility, infertility?
I think more the idea is less about there being between fertility, more the anxiety, the worry and the stress, because that plays such a massive role into infertility. There's no reason why with pelvic floor dysfunction you can't get pregnant again, but you're less likely to want to be touched, want to have sex, and also just stress and worry really plays into your hormonal system. And in order to get pregnant, you need to kind of be in a good place a lot of the time. So I think I think it's more that plays into the fertility question.
And the painful intercourse, perhaps like if their muscles are extremely tight or too loose, right? It's mainly the lax rather than, can there be times when it's really, really tense as well? Does it go up and down between tension and lax?
Yeah, it tends to be more that it's just really tight. So we have vulvodynia and so we have if you've got an over tense pelvic floor, it can become super, super tight and then it can become really painful. More of a lax pelvic floor, when the symptoms between having a really over tight pelvic floor, an overactive pelvic floor, and an underactive pelvic floor are really, really similar.
Right.
So you can get a lot of the same symptoms, but what comes with an overactive pelvic floor is pain. And so that's one of the biggest signals that you're perhaps actually not got an underactive pelvic floor, but actually possibly it's overworking.
And that's why they can contribute. Like I've heard of clients and even people who've got very, very painful intercourse that doesn't even make it pleasant. And obviously, if you're trying to have a baby, right, or a second child or third, it can be quite stressful.
I mean, when my ladies come to me and they've got the issues with tight pelvic floors, I look at their nervous system really first. So we look at how we can create more safety for them and downregulate their nervous system. So they're not stuck in a kind of fight, flight, fear, anxious kind of situation with their nervous system, which is when I bring in shaking therapy and TRE, so tremoring and breath work as well. So it's not necessarily about looking at the woman's pelvic floor, it's looking at the whole woman in front of you, because the pelvic floor what happens on the pelvic floor, symptoms from the pelvic floor tend to be like signals that something else is out in the rest of you. So it might be your posture, it might be your breathing, it might be just that your brain is overworking things. There's lots of different reasons why people have pelvic floor issues. And I think that a lot of times we are very reductionist in our thinking and we just look at the pelvic floor instead of looking at the whole woman in front of us. What's going on with her? Why does she feel this unsafe, that her pelvic floor is holding this much tension? What's happened to her previously? It's then really important that we find out her history, because we're not just our pelvic floors.
No, yeah, that's right. And how does that health, our pelvic floor health in pregnancy, influence like basically birth outcomes or pregnancy outcomes? Has there been a correlation to obviously doing some of this work in pregnancy itself to minimize perhaps some of the dysfunction that may occur after or during birth and after birth?
Absolutely. So a lot of people have very locked rib cages. So if your rib cage is quite locked, if you tend to just belly breathe or you tend to upper chest breathe, then what happens during pregnancy is that your body has to make room for the baby. So what it does is that you start to flare your rib cage forwards. And you can try it just now, Ellie, and whoever's listening can try it. If you flare your rib cage forwards, you start to feel, you get that kind of concave feeling in your back, that pain. But also the bump sits really far forwards.
Yeah.
So during pregnancy, we already tilt forwards a little into an anterior tilt. That's a totally natural thing. But then when the rib cage starts to join in on the action, the bump comes right out the front. The back takes all the strain. And the muscle in the back that takes the most strain is called the psoas muscle. And it's in old thinking about pregnancy, and in new but old thinking about pregnancy, the psoas muscle is seen almost like the runway for the baby or the cradle for the baby. So if during pregnancy, you can start mobilizing your rib cage, so really focusing on, instead of breathing up to your upper chest or breathing predominantly in your belly, we think about your whole body taking the breath. And so if you can think about your rib cage widening to the sides and to the back and really widening, then that helps to create a much more supple psoas. And my ladies who've done the work with me after their first pregnancies, or during their pregnancies, their bump sits much further back in their body, like it's supported. Because if we think about where the psoas muscle is in the body, which is really cool, it comes from your back about where your bra strap is, it runs down your back, and then it cradles your pelvis. So it is like, it's like a beautiful carrier for your baby during pregnancy. So if you can mobilize your rib cage, relax your jaw, because by relaxing your jaw, we create better tone in our pelvic floor by over 54%. So
Wow,
Relax the jaw.
Mm.
It's huge. It's a huge
So many
percentage.
people have such jaw tension, or they're grinding at night, or when I go and feel and do like work around here, there is so much tension in the cheeks and back into their necks, and yeah, SEMs are tight.
Yeah. So it tends to be SAM. So the scalene muscles tend to be used as a secondary breathing muscle.
Right.
So instead of people, my ladies, widening their rib cage when they breathe, they tend to, if they're upper chest breathers, they tend to lift their rib cage up and down like this.
Yes.
And this is really, it's a breathing pattern, but it's a dysfunctional breathing pattern. And so we want to encourage a breath that we widen our rib cage, we widen our abdominals all the way around, and we really feel our breath going all the way down to our pelvic floor. And that's kind of a big part of what I teach.
It's really different because you're normally here in pregnancy to hold that pelvic floor, like you're going to do a wee and you hold that and you're working on, because that's what I used to do in pregnancy as well. You're just holding that. But now you're saying it's all actually all the upper muscles and also the psoas, the back muscle, the neck, all the way up to the entire body, in the way that's all structured nicely during pregnancy to support. And then leading to perhaps outcomes of the pregnancy itself, as well as, making sure that the pelvic floor is not damaged after, or the muscles are still intact and working well after pregnancy.
Yeah, so the thoracic diaphragm, you have this sheet of muscle that runs around your body, in the center of your body. It separates your kind of digestive system from your breath, and it hangs out underneath your rib cage. And the diaphragm's a big part of what happens during birth. It helps with you moving the baby through the birth canal. It's a massive part of your breathing apparatus. But the more healthy that diaphragm is, the more healthy your pelvic floor is. So, and using your rib cage to breathe is one of the best ways for creating a healthy thoracic diaphragm, and then a healthy pelvic floor as well.
And so what symptoms usually should never be dismissed? So even during pregnancy, even straight after, what symptoms should, never be dismissed? Even if a doctor who's not probably an expert or hasn't done proper assessment, if you feel there's something not right, what should be the first thing?
The first thing is a feeling of not being right. If you get a feeling within yourself, trust your feeling and trust your intuition and go and get yourself checked out by a specialist. The other one is pain. Pain is a marker. It's pain is a huge marker. Any sort of bleeding at all.
Right.
Pre-pregnant, during your pregnancy, afterwards you have lochia going on and other stuff going on. But just the biggest thing is during pregnancy as well. Make sure if any bleeding gets checked out. And needing to go to the toilet all the time will tell you. I mean, as we go through pregnancy, there's much more weight on your bladder.
Yes, you do tend to go more even.
You tend to go more. But if you find that you are going, if you talk to your friends who've been pregnant and, if you're going on a lot, then go and speak to a specialist, because it could be that you're just not managing your intra-abdominal pressure as well as you could be. So during pregnancy, we can still manage our intra-abdominal pressure through posture, through breathing, through relaxing our jaw, and also through our feet. So your feet have a big part to play. The nerves in your feet, you've got 250,000 to 300,000 nerves in your feet, in each foot. And those nerves share the same nerve root as your pelvic floor. So the same nerve root area. So the more we can mobilize our feet, the more we're mobilizing the nervous system around our pelvic floor and keeping it healthy. So definitely that. Yeah.
With foot massages during pregnancy.
Oh, defo. Yeah, defo. You've got a real reason to have them done.
What about lower back pain? You mentioned a bit of back pain. So back pain, hip pain, tailbone pain, are they all linked to pelvic floor? It's obviously all in the sort of region, but
so,
they be linked?
So your sacrum and your tailbone, they're attached to your pelvic hammock muscles. So tailbone pain can be because there's too much tension there.
Yeah.
It could just be the load of the baby as well. So during pregnancy, what tends to happen is your pelvis tilts forwards a little, and this can create some tension at the back of your sacrum. So that's like in between the two halves of your pelvis. And because your ligaments are much more lax, that can create instability there. So it can create pain. And for that, the best things to do is just keep moving, but moving gently. Don't overstretch anything because you're full of relaxin. Hot baths, hot compresses, and just making sure that you stay mobile, but don't do anything. I mean, if you're starting to get pain in your sacrum, then you want to make sure that you look at your posture, you look at your breath, And you make sure you're not doing anything too high impact during the pregnancy as well.
What if it wasn't from pregnancy? What if there was some sort of impact or some sort of, like a impact sort of on there on the tailbone itself? And then can that be then linked to pelvic floor dysfunction if they've had some sort of fall or impact, especially
Definitely.
slipping on the floor on tiles or, at home?
Yes, I mean your coccyx can get really
Yeah.
easily damaged, and quite often it can pull off to one side. So going to see somebody like a osteopath or a chiropractor, just get your pelvis realigned, is a really, really useful thing to do in that circumstance. Definitely.
I loved having osteo treatments throughout my pregnancy. It was so good.
Osteo's
Like I think
brilliant.
yes, for those who actually really know what they're doing, work with pregnant
Yeah.
clients, it can be so good because you don't feel all the muscle, the tension, that like you said, the baby's sitting right, you can walk and still do. Some people can barely walk in their last trimester. A lot of people after 30 weeks, they're so heavy. And if the baby's big, they're in a lot of pain and then they're not moving.
And you've also got that increased laxity. So if you're already hypermobile and then you go through pregnancy, quite often that can cause a lot of issues with instability in the pelvis. So definitely getting some osteo treatment is a massive thing.
Yeah.
Definitely.
What about how is pelvic floor dysfunction assessed? How would you typically assess pelvic floor and what should someone expect when they're getting a pelvic floor evaluation done?
So I don't do internal pelvic
Yeah.
floor
Mhm.
examinations. So I generally go on symptoms and how
Yeah.
the woman is. So I address posture, I address breath, and I address symptoms, and then we look at the whole picture. But if they're going to go and have a pelvic floor exam, they want to make sure that the person who's doing it is really well qualified.
Right.
Get recommendations.
Okay.
There are good pelvic floor physios, and there are not so good pelvic floor physios.
Mm.
So just make sure you get somebody who comes really well recommended. There's some amazing pelvic floor physios out there. And make sure that they don't just give you Kegels to do or pelvic floor squeezies.
Yes.
Ask what else you can do. Get actual exercises that are to do with full body movement. So that could be squats, it could be little lunges, it could be sit to stand. It could be working on your core. Um, Pelvic floor health is not just about how hard you can squeeze.
Mm, mm.
A lot of times when you go for a pelvic floor examination, they'll just
Just get
test
squeezed.
how supine, lying down, how much you can squeeze. And they might not even be able to notice from there whether you have a
Oh,
prolapse or not, even though you're convinced that you do have one.
yes. Yeah.
So make sure that you're examined standing up, if at all possible. Make sure they examine you coughing, so that we can actually see a true picture of what's going on with your pelvic floor. And make sure they've got warm hands, I guess, as well.
Little things, right? Oh, it's all comfort because if the hands are cold
Yeah.
instantly, right? The nature is to contract.
Oh, and my other big one is when you go for a pelvic floor exam, try and get somebody else to look after your babies. So I know a lot in the UK because they make them in the middle of the morning and things, and you've got a baby, and then the baby's screaming. You're trying to do your examination, so just make sure that when you go, you can take a friend with you as well. Get somebody to look after your baby, and make sure that you take the time to do it and do it well
And how
as
long
well.
does recovery typically take? I mean, even for someone helping clients, like how long do you see if they're doing all the things they need to do? Is their recovery fairly quickly?
So it depends on what's going on with them, because the big thing with us women is that we have babies at different ages. So our hormones are at different stages. We have different connective tissue types. But what I say to most of my women is that if you went to the gym and you were working like a gym muscle, like a fast twitch muscle, you would start to notice a difference within 3 months. Pelvic floors are made up of slow twitch muscle and smooth muscle, predominantly. So about 69%. So it's going to take longer for you to it takes longer for it to get tired, which is a great thing, but it's also going to take longer for you to notice. So I say that steadily over the course of 6 months, you should start to notice changes. And usually with my ladies, it's urinary leakage, like urge incontinence goes first, and issues to do with the anus and rectal issues tend to be the ones that take the longest time.
Yeah,
So
but
they
they
take
always
up
just
to
start
18
feeling better.
months.
Yeah, they
Yeah.
just start feeling better and they notice, lots of things are much easier on their bodies.
Absolutely. So, but yeah, definitely as they progress through to 6 months, definitely noticing really good changes. But honestly, some of my ladies will come for 2 sessions and it'll be like,
Oh, it's
magic,
yeah.
But then
Yeah.
others, it'll take a year.
What are some simple exercises people can start at home? So you think Kegels are not always appropriate for everyone, but is there any harm in doing Kegels if, you're doing it as a prevention, say in pregnancy?
So I generally recommend that people don't do it as much as they're told to do it. So
Yeah.
I had one woman and she'd been told to do them 100 times a day. And I'm just like, I was like, would you do a biceps curl 100 times a day? And she's like, no. And I'm like, well then, so yeah, there's definitely a space for pelvic floor muscle training. So what we call Kegels.
Yeah.
But maybe just do one set. So 10 quick ones, 10 slow ones, 3 when you go up the lift. So you've got a little bit of focus on them. A big thing is working on your posture. So making sure that your rib cage is aligned with your pelvis, making sure that you're breathing really well. So really focusing on your breathing, relaxing your jaw, get some good tuition on breathing. So diaphragmatic breathing is using your rib cage with your diaphragm. Just belly breathing on its own is actually really bad for your pelvic floor. So it's just being aware that if you're bypassing your rib cage and just breathing out to the front of your abdominals, there's actually not a single muscle there that's designed to push just out in front. Our body is designed to use our lungs, our ribs, our whole abdominals, and our pelvis to breathe. So just being a little bit more aware of the breath that you take.
And just some people are also mouth breathers instead of nose breathers as well.
Yeah. So a lot of my ladies come to me nose breathing, and then initially with them, because they've got such tight jaws, I get them to inhale through their nose and then exhale through a relaxed jaw. And then when they can keep this relaxed, then we reintroduce exhaling through your nose as well. But definitely inhaling through your nose, it gives your body so much information.
Yeah, it does. So obviously over time, so if they were to do all the right treatments and that, can pelvic floor dysfunction be completely resolved over time?
Yes, so it depends on it again. It depends on the severity of what's going
Yeah.
on with them. If it's say stress incontinence,
Yeah.
then yes, a lot of times that's completely resolved. If it's a prolapse, a prolapsed organ, it depends on a lot of contributing factors. But the majority of my women become symptom free. That doesn't necessarily mean that their prolapse has changed, but it does mean that they have no symptoms. And I very conservatively usually say that if they come to me with a stage 3 prolapse, there's a good chance they'll end up with a stage 2. And if they come with a stage 2, there's a good chance stage 1. People make really big claims about being able to cure prolapse.
Yes. Yeah.
And I like to be very real with my ladies and say, listen, a symptom-free life is what you're actually looking for.
Correct. Yeah.
Yeah.
Don't want to go
Yeah.
through surgery unless you absolutely need to. So we can
Yes,
work
no.
on all of this. And then if it's really that severe, some doctors will want to do surgery, but yeah, it's not something you want to.
Some doctors want to do surgery with a stage 1 prolapse, and it's just no. I mean, the complications with surgery are huge.
Yes.
And there's also with surgery, there's a 10-year lifespan if you look after yourself really well. So that means if you're 30 and you have surgery, you're going to be looking at having surgery when you're 40 and then again when you're 50. So people will have multiple surgeries. And just having pelvic floor surgery doesn't mean that your problem's going to be solved.
Yeah.
If you have a hysterectomy, you're more likely to have a bladder prolapse or a rectocele. So
Yeah.
they don't always come with. There's no
without side effects. No, that's true.
Yeah,
Long-term, and
absolutely.
long-term issues. Yeah. What other sort of lifestyle habits can have an impact on recovery? So speak about breathing. Are there any sort of lifestyle habits that you introduce for your ladies?
Movement. So really walking. Go for a really nice walk. When you're walking, change directions. So don't just walk in a straight line.
Walk backwards, right? Walk backwards.
Walk backwards, not sideways. If you see a little step, not a big step, just a little step, start with, jump off it. It's really good for your bones. It's really good for bone health.
Yeah.
Social interaction. So a big thing is, if you're worried about your pelvic floor, I don't want you to hide yourself away. I want you to, we're humans and you need social interaction, and that makes you feel much better. And when you feel much better, your symptoms get better and you heal quicker if you feel well as well. Meditation is another good one that I give people to do. So a bit of meditation if they can. We're very busy when we've got babies. So if you can carve out a little bit of time to meditate as well, it's a really nice thing.
Diet and nutrition?
So as clean eating as possible. So eating really nice, eating cleanly, making sure you're getting enough protein to feed your collagen. It's really important as well. Whether you're vegetarian or pescatarian or, you eat meat, there's always ways for you to find protein for your diet as well. Do you know another nice thing I like to give them to do, which I give all my ladies to do, is to write a love letter to their vagina and their vulva area. So they write a love letter because oftentimes my ladies come to me and they say, I feel like me above here.
Yes,
And I
yes.
don't feel like me.
A bit of numbness down there.
Yeah, so I think that going back and instead of thinking that your pelvic floor is against you, is to actually think about what it's done for you and with the love letter, you never say bad things in the love letter. You say nice things.
I do that.
Mindset.
I do that with some people who are going through cancer as well, like breast cancer as a lady. And I'm like, you've got to love your breast. I know you're sort of wanting to, she gives it all sorts of nasty names. I'm like, look, it's still part of you. You want to love it because it is trying to heal also, right? But a lot of people feel disconnected. Something is causing them issues. The human nature is like, I hate it. I want to disconnect from it. And it's hard. It doesn't help the healing process.
But mindset is such a huge part of the healing process. So that's why social connection, write a love letter, and do something nice for yourself once a week. So pick something, totally unrelated to your pelvic floor. Pick something really nice, whether it's going for a massage, going for a walk with a friend, whatever you love doing, go and do it.
Yeah. And what can women do during pregnancy? Any other things women can do during pregnancy to support their pelvic floor?
So definitely just getting the breath sorted out is one of my biggest things. Posture as well is a huge one as well. And foot health. Foot health is huge.
So lots of foot massages and reflexology.
Yeah. And also mobilizing your toes. So even if you're sitting thinking about lifting your big toe up, putting your big toe down, rolling a ball underneath your foot, the feet are kind of like the windows to our pelvic floor. Yeah. So the more mobile we can have our feet, the better. And breath work, resting. I mean, I don't know if you can do quite enough rest during pregnancy.
It's true. What about Pilates and Reformer Pilates? There's a lot with that. How have you seen that's been useful for general pelvic floor as well? I mean, you're not exactly doing work around there, but even just because of strengthening your whole body,
Yeah, no. So I mean, I teach personal training, and I'm also a Pilates teacher. Mm-hmm. So I've got lots of things I do. I tend to do a mix of things with my pregnant ladies. So that we'll do, it depends on the body in front of me. But you want to stay strong and you want to stay mobile. And there's no reason why you can't do Pilates as long as you go to a Pilates teacher who works with pregnant women. Do Pilates, do yoga, any of these things that you enjoy during your pregnancy. Just seek out someone who's really qualified to work with you. It's really important.
Yeah. But definitely
check the credentials, seriously, because you can do a Pilates course in a weekend. Yes. So check the credentials.
Nice. And when should they start seeking help? We mentioned briefly, but should they be starting to have a look and seeking help immediately after giving birth, if it's necessary?
Yeah, well, after 6 weeks minimum, I'd give them rest. When you've had a baby, it's like you've got like a saucer-sized wound inside you. So rest. And then after that, seek help, yes, definitely as quickly as possible. But again, the thing is when you're breastfeeding, if you breastfeed and after you have a baby, you have a lot of relaxin in your body. Mm-hmm. And everybody's bodies are different. So you want to be working with your body with somebody who knows about postpartum care. But remember, I have a lot of women who come to me and they're like 8 weeks, 10 weeks after baby. And they're like, I've got prolapse. Oh my God, I've got prolapse. And then I'm like, well, you're still breastfeeding. You're still so early into your postpartum period.
Fourth trimester, right? Up till 12 weeks almost.
Yeah, but even like once you finish breastfeeding, it can be up to a year, before your relaxin levels go back to how they were before. And over that space, that time, when the relaxin levels are coming back to how they were before, your body can do loads of healing. So if you think, your vagina walls are really stretchy because of relaxin, so that you could have a baby, once the relaxin levels sort themselves out, you may find that your prolapse has miraculously vanished. Yes. So there's so much healing to be done in those early postpartum years. And I would say years rather than a couple of weeks.
Right. Yeah. So it's an ongoing thing, right? So should we be continually working? I mean, let's just hold back muscle. Like you said, it's everything to do with the whole structure and posture, which is some people having terrible posture even after birth, right? And they're on their phones, on their computers. And you just see everyone's got back, neck, and, muscles, like they're all so tight everywhere, upper back, middle back, neck, shoulders.
So definitely doing a movement practice that you enjoy is really important, and making sure that you don't spend long periods of time just looking at a screen. They say it's like, what is it? It's like 20 minutes looking at a screen to stand up and spend 20 seconds looking 20 meters into the distance. Is a whole 20 thing. Can never quite remember it. But it's really important for us to do that, just to recalibrate where we're at with our bodies.
Yeah. Yeah.
And the big thing with is just making sure that your head is over your shoulders as well, because as your head comes further forward, it puts an enormous amount of weight in the back of your body. So for each inch your head comes forward, it's 10 pounds of weight on your thoracic spine. So it's a lot of weight. So it's just being aware of that. Most of the things I get people to do is in early postpartum is we do loads of breath work. We do some tremor therapy and shaking therapy. I get them to do walking, swimming if they can as well. Once they can go swimming. Swimming is a wonderful thing for them to do as well.
Yeah, in pregnancy and after birth, because it's weightless, right? It's much better.
And Pilates after birth is amazing as well, because that really helps you with your alignment. A great Pilates teacher will really, really help you with that too.
Amazing. And look, what's one thing every woman should know about her pelvic floor? If they could take away one thing, what should we know about our pelvic floor?
So one thing you should know about your pelvic floor is that your pelvic floor is not a solo operator. Your pelvic floor works in conjunction with your adductors, your legs, your glutes. Your bottom muscles are a huge part of your pelvic floor health. Your shoulders, your scapula at the back is a huge part of your pelvic floor health. Your jaw. So I think the one thing to take away from it is, if anybody tells you just to squeeze your pelvic floor, then know that you should be doing a little bit more.
Well, I think you've covered all the areas, because when I do my acupuncture as an acupuncturist, I always look at their SCM, I look at their jaw, I look at their neck, and then I'm looking at their scapula. I'm always needling the scapula because it's so tight, right? Lower back, right? And it's just all those muscles are just all contributing to the stress and the tension of
Agreed. I think people's scapulas get caught though, because they do this upper chest breathing, and they think then that when they have to lift their arm up, that they lift their arm from here. And it's actually your scapula gives you if we can get it to slide, it gives you wonderful support from underneath. But I think my big thing is
just pelvic floor. The whole shoulders. Everyone's shoulders are up here.
Yeah,
so you come in and their shoulders are up near their ears.
I know. I see it all the time. So I think my biggest takeaway for people is that your pelvic floor is part of a team. And in order to have great pelvic floor health, we need to make sure the rest of the team is working really well. If you've got pelvic floor dysfunction, it's like your team member is, like, say it's a football game, like a soccer game. Your pelvic floor is sat on the bench, and we need to get the rest of the team to play really well and bring our pelvic floor back online, and give it the support that it needs and the love that it needs.
Awesome. And just one last thing, Abby, what is the best daily habit we can do for our pelvic muscles?
Breathe well.
Yeah.
I always come back to that. Relax your jaw and breathe well.
Amazing.
Cool.
Thank you so much. Look, I mean, we could talk for so much longer, but I know it's late where you are. And I want to thank you for sharing some really amazing gold nuggets. And we're going to just post all your socials on there so people can connect and see the wonderful things, and maybe, get your help if they're on this journey as well. But thank you so much for sharing your wisdom. And it's been fun having you on. Thank you.
Thanks, Ellie.
Thanks.
Thank you for tuning into today's episode. If this conversation resonated with you, know that pelvic floor symptoms are common, but they are not something you simply have to live with. Help is available, and with the right support, many women experience significant improvements in their symptoms and quality of life. So if you enjoyed this episode, please subscribe, leave a review, or share it with someone who may benefit from this important conversation. And until next time, take care of your health, your hormones, and your whole self. See you then.